Greetings to you all. Sabko namaskar. First of all, I would like to remain thankful to the organizing chairman of this CME, Dr. Kuldeep Singh, and his team for giving me a chance to be part of this very important CME, and also for giving me a chance to share this information on integrating One Health in animal rabies control. Well, the deadly disease rabies needs no introduction. Also, needless to emphasize the major role being played by the dogs, with a special reference to the free roaming dogs or the community dogs in transmission of rabies, not just to human beings but also to various other species of animals. Nearly 98% of the human rabies related deaths are attributed to the rabid dog bites, but nevertheless, the other biting animals, including the rabid cats or the rabid wolf, jackal, foxes, mongoose, they also could be the source of transmission of rabies to human beings. Considering the seriousness of this deadly disease that cannot be cured but can definitely be prevented, the World Organization for Animal Health, that was actually known as OIE, that stood for Office of International Epizootis, the headquarters of which is actually based in Paris in France. OIE actually supports the elimination of dog-mediated human rabies. Well, we know about UAR, which stands for United Against Rabies Consortium, that comprises of WHO, FAO, OIE as it was known then, now it is OWA, and then Global Alliance for Rabies Control. They have taken a call a few years ago to ensure that the dog-mediated human rabies is eliminated from the world by 2030. Well, we are already at the end of the year 2024, hardly 6 years to go for all of us. We have to be working on war footing to achieve this zero rabies by 2030 as far as dog-mediated human rabies is concerned. Well, accordingly, the government of India has also launched what is called the National Action Plan for Dog-Mediated Rabies Elimination from India by 2030. This was on the World Rabies Day that was actually observed on 28th September 2021. Well, this NAPRE, National Action Plan for Rabies Elimination, has got two very important components. This is where the One Health functioning as far as integration of One Health in control of dog-mediated rabies in India is concerned. Animal health component comprises of the capacity building, the training, then the development of human resource, and most importantly, the implementation of mass dog vaccination supported by dog population management. As far as the human health component is concerned, primarily the post-exposure prophylaxis, the PEP, is actually emphasized, simultaneously associated with the capacity building, the development of human resource through various hands-on experience-based training programs. There are certain steps which a state will have to employ or follow to declare that state or a region or a zone or a district to be free from rabies. First, we need to ensure that the rabies is notifiable in case of both human as well as the animal sector. Then report the decrease in the number of dog rabies cases in that particular region. This should be followed by reporting a decrease in the number of human rabies cases in the same region, and then ensure that there is not even a single case of rabies in dogs for a period of 2 years minimum. Then this should be followed by absence of confirmed cases of rabies in case of human beings for a period of 2 years. Then only that particular region or the district or the zone will be eligible to announce that the particular region is actually free from the deadly disease rabies. Then only the state can declare that it is actually free from rabies. Well, considering a variety of challenges that we have been facing in India as well as South Asia, the KVAFSU-CVA Rabies Diagnostic Laboratory, with which I have been associated since last nearly 15 years, was established at Veterinary College in Bengaluru, thanks to the CVA, with the support of which this particular biosafety level 2 lab, which is dedicated for animal rabies research, was established in India. And thanks to the OWA, through the OI twinning program that we implemented in our laboratory dedicated for animal rabies research, this OI laboratory twinning project actually went on for a period of nearly 3.5 to 4 years, from 2016 through 2019, wherein our team had a chance to be associated with the CDC Atlanta and then the APHA at Weybridge in the United Kingdom. These two have been the OA reference labs for animal rabies in the USA as well as the UK. And our team had a chance to visit these two OA reference labs, and then the team from CDC as well as APH, they visited our lab. So thereby, we were successful through this wide training program in strengthening the diagnosis of animal rabies in India. We conducted series of national level training programs. In this picture you can see, in the map of our country, you can see various veterinary institutions with reference to veterinary colleges, various other veterinary universities were supported for establishing a small animal rabies diagnostic facility as a part of this wide training program. And this was one of the successful programs wherein we were able to have a harmonized approach as far as animal rabies diagnosis is concerned in India. Well, as I already said, the establishment of our rabies diagnostic laboratory was actually a milestone, and we have actually 4 important mandates. As we can see, the diagnosis of rabies by employing the WHO or the OA approved test, and then we are also associated with sero monitoring, where we are into estimating the anti-rabies vaccinal antibodies. This is a very important mandate of our lab. At present, we are employing this for international movement of pet animals, but now that the mass dog vaccination is also implemented in various other regions in the country, we need to have a tool to monitor the successful implementation of this mass dog vaccination program, which is actually the practically oriented approach to ensure that the dog rabies is actually controlled. And thanks to the DBT for supporting us to develop this recombinant G protein based ELISA, so which we have actually developed in association with the National Institute of Animal Biotechnology based at Hyderabad. And then the third mandate is phylogenetic analysis, the molecular characterization of the isolates of rabies virus from different parts of India, different parts of South Asia. And then we would like to identify the kind of sublineage which is actually lurking in India. Then final and yet another very, very important mandate of the laboratory is training workshop, wherein we are directly associated with the development of human resource as far as diagnosis of rabies is concerned, and then control of rabies with reference to dog mediated rabies is concerned in this part of Asia. We have what is called RAB lab, which is nothing but the reference laboratory network for rabies, and globally as of now we have totally 14 OA reference designated reference laboratories for animal rabies, and the mandate of these 14 OA reference laboratories is to improve the diagnostic capacities of these regions, and then standardization of laboratory techniques, they develop the laboratory techniques, and then ensure that we have a harmonized approach as far as diagnosis of rabies in case of animal is concerned. Here I just would like to emphasize that these tests are not only employed for the animals, but the same test can also be employed for the confirmatory lab-based diagnosis of rabies in case of human beings. And you can see here we have totally 14 OA reference labs in the world. Ours is the 12th, and this is actually the jurisdiction with which we are associated as far as capacity building is concerned. I said we are associated with conducting series of training programs under this capacity building for the purpose of development of human resource in this part of Asia. And then primarily in our training programs, we focus on collection of brain stem through the occipital foramen approach. This is one of the most simple approach as far as brain sampling is concerned, and this technique has revolutionized the diagnosis of animal rabies in this part of Asia. And this technique is not only employed for dogs or cattle or horses, these techniques are also employed for collection of brain sample through the wild animal rabies, which is also there in certain hot spots in the country. Well, this is the slide that shows the impact of our training program on occipital foramen method based training program. And nearly 15 to 20 times more number of brain samples are being submitted to the laboratory for confirmatory diagnosis of rabies. This is one major milestone, this is one major breakthrough. But our country as well as most of the South Asian countries as well as Southeast Asian countries, we have a big chunk of private veterinary practitioners. So they also play a major role as far as rabies diagnosis and control is concerned. So considering this important issue, we have also pitched in the private veterinary practitioners domain, and then we are also involving them. We are also training them. We are also well connected with the private veterinary practitioners. On being invited, our team, we actually visit different states, different regions in India, and there also we conduct a training program so that more and more number of veterinarians are actually benefited. Thereby we have a very good force at the grassroots level in the country for brain sampling and then for subsequent diagnosis of animal rabies. We have been associated with the conduct of international training programs, as I already said, thanks to Mission Rabies as well as the OVA RRAP. You know, RRAP stands for Regional Representation for Asia and Pacific, which is actually based in Japan, catering to the requirement of the Asia as well as Pacific region, comprising of 36 countries. And here also we have identified several key topics for having harmonized approach as far as rabies diagnosis and surveillance is concerned in South Asia. Very recently, with the support from OVA RRAP in Japan, our laboratory, we have actually established what is called SA-RABNet. That actually stands for South Asia Rabies Laboratory Network for harmonization of rabies diagnosis. Then subsequently, under this OVA sub-regional training workshop on animal rabies diagnosis, we have also trained veterinarians from 14 government officials from different South Asian countries. Well, this is where we can see the impact of the training program. This has been highly encouraging. Collection of brain samples and then diagnosis of rabies just by the side of the carcass. And this is what you can see the images from Nepal, Bangladesh and a couple of other South Asian countries. And needless to say, the charity always begins at home. We have a robust rabies diagnostic approach leading to effective surveillance mechanism for rabies in India. Here you can see the glimpse of a series of national level training programs that we have conducted for our veterinarians involved in rabies diagnosis and control at the grassroots level as well as at the city level in different states, and this has been really amazing. Well, BBMP stands for Brihat Bengaluru Mahanagar Palike. You know, we cannot be working under isolation. Like we have to have the veterinarians, the medical professionals working under the same umbrella of One Health with the support from most important sector, that is municipal corporation. So we got ourselves associated with the Municipal Corporation of Bangalore City with the support from Mission Rabies, and then we have established what is called a rabies helpline, and we have already initiated mass dog vaccinations in BBMP jurisdiction comprising of 8 different zones. And we have also trained several veterinarians who are actually associated with collection of a brain sample. Then these samples are submitted to our laboratory. In our laboratory, we actually diagnose rabies by employing the WHO approved test. What I mean to say here is, please appreciate there is significant reduction in the occurrence of laboratory confirmed cases of rabies in case of dogs in BBMP. The control of rabies is a wonderful model for One Health collaboration with the various other sectors. You know, the terminology One Health was actually first coined hardly some 20 years ago. But we, the Indians, we have been employing these integrated strategies at the human, animal, as well as environment interface. We have been living with the nature, we have been part of the environment, we have been associated with several livestock species as well as the pet animals since ages. We have been already practicing One Health, especially in India, since ages. But now, the WHO, OAH, as well as the government of India have embraced this One Health approach primarily to combat this deadly disease rabies. Good that the One Health Joint Action Plan is supporting the activities of the UAR and One Health in action at the global level. OAH experts as well as the WHO experts, we keep meeting at the global level in different parts of the globe, and then we have the brainstorming session how to harmonize the approaches as far as diagnosis and then the capacity building and then the control of rabies is concerned. Because unless we control the rabies in case of dogs, it's really tough for us to think of controlling rabies in case of human beings. So all these multi-sectors have to be joining their hands for under this One Health umbrella. Well, recently we had this regional workshop for the OVA national focal points in Japan, where the OVA RRAP catering to the requirement of 36 countries is actually based. And then very recently we also had the regional meeting involving the Asia Pacific region, where the human experts on rabies and then veterinary experts on animal rabies, all of them had a chance to sit across the table and then have brainstorming session and then evolve the feasible strategies for implementation of rabies diagnosis as well as control. Under the umbrella of National Action Plan for Rabies Elimination, State Action Plan for Rabies Elimination is also being planned and is also implemented in some of the states in country, and Karnataka is also in the forefront We have to be strictly associated with various other multi-sectors, including the human sector, the forestry department, the revenue department, the policy makers, and with the various other sectors, including the vaccine manufacturers, the diagnostic institutions. And this has been already initiated in India with a special reference to Karnataka. One of the most important component under this One Health umbrella is the general public, the community. So it is very, very important for all of us, the experts, to join our hands to bring a kind of awareness among the general public, and this is what we are also into. And since last couple of years, we have conducted series of such awareness programs, especially when we observe this World Rabies Day on 28th September every year. Well, this is as far as the joining of hands by the animal health professionals as well as the human health professionals with other sectors, including the civic bodies, the municipal corporation, when we observe the World Rabies Day. And here we can see the awareness for the general public, awareness for the students, and awareness for the other sectors. Very recently, just this year itself, just last month, we had a series of activities carried out right from the free anti-dog vaccination programs, and then free anti-rabies vaccination program for the risk group of human beings, and then bringing a kind of awareness for the student community, for the general public during, Mysore Dasara is very, very famous. And as a part of Mysore Dasara, so we had also our dedicated rabies awareness stall installed there, wherein we were able to show the rabies viral inclusions to the students and then other general public. That was one of the most successful awareness oriented program. And then very recently, with the support from WHO as well as WOAH, NIMHANS, which is actually housing the WHO CC for human rabies in India, and ourselves from OR Reference Lab for animal rabies from Veterinary College, Bengaluru. We too actually played a major role in organizing a 1 week long hands-on experience based rabies diagnosis training program, wherein we had nearly 7 human doctors as well as some 8 veterinary doctors who are actually working in the domain of human rabies as well as animal rabies respectively, undergoing this training program. This is real One Health. We are very closely associated with NIMHANS in carrying out series of such programs for the benefit of both human sector as well as the animal sector. Here I can see we had a huge walkathon program could be conducted to bring a kind of awareness and then to make the general public realize and then make them accountable, make them part of this One Health oriented rabies control programs. Well, as I said, the community engagement is important, wherein we have to make the pet owners, the vaccination awareness as well as the response education will have to be brought in. Well, whenever we do any activities, we are bound to face any kind of challenges. Despite all these challenges, despite all these gaps, we in India are committed to ensure that we are going to have this dog-mediated rabies controlled effectively, and then think of elimination of dog-mediated human rabies. So with this, India can definitely make it, we all can definitely make it, and we means it is including we all, our family, our friends, as well as our community. And with all these collective efforts, the committed efforts, with a lot of patience, we can be responsible for ending rabies in our country, India. Well, before I close, let us offer our respectful pranamas to this great scientist Louis Pasteur, who actually saved the mankind through the development of the first anti-rabies vaccine way back in the year 1885. That 6th July was the first boy, the first human being, he was actually vaccinated, and then his life was saved. And that's the reason every year 6th July we actually celebrate that day as the World Zoonosis Day, and then every year 28th September we observe that day as the World Rabies Day, because it was on 28th September that the great scientist Louis Pasteur, he passed away. So with this, let us work collectively against this deadly disease rabies with an attitude of never give up. And in his own words, his strength lies purely and solely in his tenacity. Tenacity means patience. Let us work collectively with immense patience for the sake of our society, for the sake of our country, by joining our hands to end the human deaths because of the deadly disease rabies, which is primarily mediated through the dogs. Thanks to you all once again. Thanks to my team. It is always the team that is always the successful. Thank you so much.